So basically, when I was a kid, I had radiation on my brain, and it damaged the part of my brain called the cerebellum, which controls balance, coordination. Needless to say, my balance and coordination are not very good. So I started coming to Burd in November, so just to improve my general balance, and I've definitely noticed an improvement.
Evan came in complaining of just coordination issues, and during my eval I found out he had an radiation-induced form of ataxia, which is kind of a fancy way of just saying, balance problems. So his form of ataxia is moderately progressive. He noticed he had difficulty doing daily activities that he really enjoys, like bike riding and playing golf. I did my eval, started with traditional balance exercises, but I really, in the back of my mind, thought he would be perfect for the SmartFit. The SmartFit's designed for orthopedic and neurological conditions, but I think works especially well with neuro conditions. So
I've actually never used anything similar to a SmartFit, aside from like a whack-a-mole at an arcade when I was a kid. I think it definitely helps with coordination.
The SmartFit focuses on, it's a dual task motor cognitive training machine, essentially. So just a fancy way of saying you work on muscle activity in combination with reaction time and accuracy. So it can be used over, across a variety of patient populations.
Yeah, it kind of works on both, like balance and coordination at the same time, because I do things like standing on, you could do anything with it, like standing on one leg or with a tandem stance, which makes it a little more difficult.
I do think it really can be especially good for him because you can customize treatment plans and really work on his specific goals. There's different levels of sensitivity. You can challenge it by creating, using AirX for balance, or the Bosu ball, ways to balance on one leg. I mean, there's so many different ways to kind of progress. And each week I look back at his average, and not only his average score, but his accuracy level as well. So that kind of gives him motivation of, hey, I beat my score last week, or my average is slowly going up. So it really keeps him involved, just makes his life not only easier, but just it makes him more confident and independent too. Pretty much use this machine with every patient. I mean, you can use it with anything from a hip, a knee, an ankle, and again, they're competing against themselves. So you'd be surprised how competitive people are when it comes to that. So it keeps the patient involved in their own progress and really helps keep them motivated, and in turn, helps them return to therapy and also continue to do their exercises at home too.
I feel like Burd is a little more personal. Burd was the only one that took my insurance and had a 5-star review, and they had like lots of reviews, lots of 5-star reviews. Every single one was 5 stars, and I see my balance and coordination continuing to improve.